Okay, now we're in the dental hygiene lab with Program Director Peg Boyce. Hello, welcome. Thank you for doing this. I'm looking around. This is a lot of chairs and stuff. How many students do you have in your program?
We take 36 students each year, and so we have over 70 students in the program because it's a 2-year program.
Okay, so I'm assuming it's like the rest of health professions. If you graduate, you pretty much get a job, right?
Yes, and after the pandemic, there have been a lot of jobs available. It's a good career. People stay in dental hygiene for their whole life. Jobs are there.
What kind of things do they do? I mean, I know most people think, oh, well, it's just, you know, you get your teeth cleaned.
Right.
But there's probably a little more to it than that, isn't there? What kind of things do they do in their job?
Yes. So our profession was started as preventive nurses. And so the point of a dental hygienist was to educate people about dental diseases and prevent diseases. So cleaning somebody's teeth is only part of that. We are educators, and we try to help people understand what's going on in their mouth and how to prevent both cavities and gum disease.
Wow, see, you learn something every day. I did not know that.
Yeah.
Okay, so I know you have all kinds of students from everywhere.
Yeah.
What kind of students excel at this?
So usually it's students that want to go into a health career. They like working with people. They want to help people. And maybe they don't necessarily want to be a nurse, but they want to be a health professional. So they're students that a lot of times have really liked their own dental hygienist and have had a good experience, or they've had braces and they really like a good smile. They're interested in teeth. A lot of students say that. What's
their day look like? I mean, when I go to my dentist, it seems like there's always people in and out.
Yeah.
I mean, are you doing a bunch of different things a day? Is that kind of how it works?
Yes. So usually you have a schedule and you see 8 to 10 patients a day. And you work with your own list of patients. So you have your schedule that you follow. Children, older adults. You provide x-rays, sealants on kids, do the cleanings, a lot of oral health education. We can now give local anesthesia, so sometimes the dental hygienist in an office will pop in and give the local anesthesia before the dentist starts working on a patient. Lots of infection control.
What's it like in the classroom? Like, I know it's a 2-year program, so they're taking their classes and doing this, but what kind of studies kind of prepare them for dental hygiene?
So they have to have Anatomy and Physiology 1 before they start our program. And then we highly recommend that they have their other courses that are non-dental hygiene courses before that as well. And so that would be Anatomy and Physiology 2, Microbiology, COM or speech, English, psychology, sociology. And if a student can take those courses before they come into our program, then their focus when they're in the program can be their dental hygiene courses. And they usually will do much better in their classes if they don't have those additional classes as well.
Right. Okay, so people should know this, but maybe a lot of people don't, but your students actually work on patients here on a pretty regular basis, right?
Yes. Yes, they start working on each other the first semester or on models. And then by January of that next semester, they're seeing public patients in our clinic here. We have 17 chairs, and patients come in, they can get their teeth cleaned for $10. And they realize that the appointment is longer. It's a 3.5-hour appointment, but the students have a lot of paperwork, and there are different points in the treatment where the instructor checks what they're doing. We do full medical histories, we take blood pressures. A lot of people don't understand that we would do something like that. But our students learn that the whole body is connected to the mouth. So whatever's going on, if they're diabetic, if they have heart conditions, if they have exercise-induced asthma, all of those things affect what we're doing in their mouth.
Okay, and I've been kind of asking this question for everybody, but I know you probably seal students a lot, you go out in the community. What's it make you feel like when you see your students out there doing so well in the community?
Probably one of the best rewards you get is a student texting you or emailing you later saying, I just had my first day of work and I was so nervous, but it was awesome. And usually our students get out in jobs and they love them. and they work as good team members. We talk about that. You're part of a team, and so you have to get along with everybody. You have to go over and above. And so, yeah, the best thing is to have the student contact you and say, I just love what I'm doing.
And when they leave here, you know they're ready, right?
They are novice. We say they are novice, entry-level dental hygienists. We often tell our students, the next 2 years of your education is going to come out in practice when you are seeing 8 to 10 patients every day. Then you get really good at what you're doing.